afternoon. Welcome and thank you for joining us. I'm Alysson Satterlund. I serve as Vice Chancellor of Student Affairs, and I will be your moderator for this Employee Vaccine Mandate Town Hall. We are happy to have you with us today as we cover important aspects and details related to the UC Office of the President vaccine mandate and how it impacts our campus here at UC San Diego. Please feel free to use the Q&A window to submit questions for our panelists throughout the presentations and during the Q&A portion. And due to our time limitation, we will not be able to get to all of your questions, but we will log them and ensure to post answers to our Return to Learn website. Today's webinar has live closed captioning available in two ways. First, you can click on the closed caption button at the bottom of the screen and select Show Subtitles, or you can also click on the link that is pasted into the chat. And now I'd like to introduce Chancellor Pradeep Khosla for some welcoming remarks.
Thank you, VC Satterlund, and welcome everybody and good afternoon. As you all know, our Return to Learn strategy was designed with layers of protection to help keep our campus community safe. And our success during the last 18 months has been recognized nationally. We envisioned a Swiss cheese model where each slice of the cheese represents a layer of protection. So even though each slice may have holes in it, but combined with other slices, they form a solid block of cheese. And in our case, a solid block of protection against the SARS-CoV-2 virus. The UC vaccine mandate adds one more slice of protection to our block. Vaccination is the next logical step to maintain our record of low infection rates on campus. It is the most effective tool in our toolbox of defenses. Vaccination increases our ability to study, research, and care for patients in person and unencumbered. The UC system is not alone in setting this policy. In fact, more than 600 colleges and universities nationwide have announced vaccine mandates. So I urge you all to get vaccinated if you have not already been vaccinated. You can make an appointment at the Price Center. It is free, it is easy, and it is fast. And if you're already vaccinated, please follow the steps to share your status with UC San Diego so we can update our database. And if you're not able to be vaccinated, please complete a request for exception or deferral. Our campus has been one of the safest places in San Diego County throughout the pandemic. And this was made possible because of your actions. I deeply appreciate your willingness to take precautions to keep everybody safe. We will continue to be successful because of your continued commitment to safety. So thank you, thank you, thank you. And Dr. Satterlund, I turn this back over to you.
Thank you so much, Chancellor Khosla. I would now like to welcome our co-host of this town hall, Executive Vice Chancellor Elizabeth Simmons.
Thanks very much, Vice Chancellor Satterlund, for the introduction. It's a great pleasure to co-host today's town hall with Vice Chancellor and CFO Pierre Ouillet as we review the latest developments on our return to campus nearly a year and a half since the majority of Tritons amazingly swiftly transitioned to remote operations. The vaccine mandate and what it means for fall 2021 is understandably on many people's minds, and we'll focus today's discussion on these important issues. But before we jump into the program, I do want to start by expressing gratitude once again to all of the academics and staff for your support of our entire university community. The commitment, resilience, and adaptability that you have demonstrated during this difficult time, in addition to your diligent adherence to safety guidelines, have enabled UC San Diego to continue functioning as a top-ranked public university. And thanks to you, we've continued to provide an outstanding education to students, do cutting-edge research, and care for our students and patients right here in our campus facilities. You make me proud to be a Triton. And as we look forward to welcoming a new cohort to campus this fall, it'll be wonderful to see our students benefit from the immediacy of in-person seminars, hands-on lab and studio courses, and a broader array of research, internship, leadership, service, and creative opportunities. Well, we've received numerous questions for today's session, I think the most ever since we started hosting town halls. We will address as many as we can, and the rest we will post answers to them on the RTL website. And again, thank you for your continued patience and flexibility as the public health situation continues to evolve locally and around the world. So please do visit the Return to Learn website regularly to learn answers to the latest questions. That's returntolearn.ucsd.edu. Vice Chancellor Satterlund, back to you.
Thank you, EVC Simmons. I would now like to introduce our first presenter, Dr. Chip Schooley, Professor of Medicine, to speak about the Delta variant and vaccine safety.
Thanks very much, EVC Satterlund. I'm going to try to briefly run through some topics related to the vaccine and to the variant evolution, which is affecting the vaccines, and then hope to have some time to address people's questions later in the day. Starting out, I want to make a point about what the reason why we have vaccines. The main reason that vaccines were developed centuries ago was to try to prevent people from becoming ill. This is why a smallpox vaccine was developed and all the ones since then. Secondary goals of developing vaccines are to try to prevent people from becoming infected in the first place, to reduce the amount of spread in the community, or in the case of viruses like COVID, to decrease the evolution of variants. But the main reason for vaccination is to reduce the number of people who become ill or die. Next. We've known from the clinical trials with COVID, you've seen this slide before, that with each of the vaccines out there, after vaccination, the red line shows people who were vaccinated, the blue line shows those who got the matching placebo last fall. Those who got the vaccine had a dramatic drop in the number of new cases of COVID about 2 weeks after their first vaccination. Next slide. In real life, we saw the number of cases in the US decline over the late spring as vaccines became more widely available. But what we've seen lately is an increase in the number of cases across the US. Next. But it's very clear that these new cases are being driven very much by states in which vaccines have been much less effectively rolled out. Much of the US outbreak is in states where the base vaccination rate is on the low end of the spectrum. The numbers below each of the states that are surging, you can see, are the percentage of people who are fully vaccinated in that state. And the states like Louisiana that are on the bottom of the totem pole are ones that are having surges that are worse than the ones they were having in the winter and where they're rapidly running out of hospital space. Evidence that the vaccines are having an effect. Next slide. The question that we get a lot, though, is if these vaccines are so good, why are we seeing breakthrough infections? As I've already said, vaccines prevent disease much more than they prevent mild infection. And most of the cases that we're seeing that are severe and in the hospital are in people who are not vaccinated. We also know that immunity from vaccines and from COVID diminish over time. We're now about 8 months after the first round of vaccination, and the people who are vaccinated first were the ones who are at greatest risk and would be expected not to have had as good a vaccine response as people who don't have these risk factors. So it's not surprising to see vaccine breakthroughs occurring. We're also seeing new variants occur, and I'll talk about that in a few minutes, because these variants are not as responsive to protection from vaccines as the ones from which the vaccine was made. Next. Now, this is just a graphic that's more complicated than it needs to be, but what it basically shows as you move out here to the right, vaccines become more and more effective after you've been vaccinated for a more prolonged period of time. They're not as effective in the first week after vaccination. And when you look at the very bottom three panels, out here at the bottom right, you can see that vaccines are 99.5% effective in preventing people from being hospitalized or dying. They're a little bit less effective in terms of people getting symptomatic disease, fever, feeling bad for a few days, and they are less effective than that in preventing asymptomatic shedding. In other words, becoming infected and not knowing it. And this again fits the biology of viruses, this virus in particular, and the effectiveness of vaccines in the past. Next. Now, do vaccines reduce the amount of virus that people spread when they are infected and have these breakthrough infections? This came from the New England Journal about 3 weeks ago. a group of firefighters and first responders who were vaccinated. Some got infected before they were vaccinated, unvaccinated, or after they were vaccinated. And the amount of virus in their noses was looked at. And you could see that the New England Journal's conclusion was there was a 40% reduction in the amount of virus in those who were partially or fully vaccinated compared to those who were not vaccinated when they became infected. Next. The problem was that in that study, this was a logarithmic expression. And when you actually calculate the percentages correctly, the reduction in virus in the nose was 97%. If you actually take into account, these were logarithmic numbers in the paper, and they failed to take that into account when they calculated a percent reduction. Next. So vaccines, in addition to having a reduction in the amount of virus spread, decrease the length of time that you have virus in your nose from nearly 9 days to just below 3 days. So people who happen to get infected despite being vaccinated, while they can still be infectious, are infectious for a shorter period of time and to a lesser degree. So vaccines do help us in terms of reducing the amount of spread in the community. Next. Now let's go back and talk about the generation of variants. What's the problem with them, and why are they making us, why is that making us see some of the problems that we're seeing with the vaccine effectiveness? Next. We've talked before at this town hall about the different variants. The one we're seeing most now is this called Indian variant. The Delta strain is what we're calling it now. And the Delta strain combines the ability to be much more infectious, which came with the Alpha variant that we saw coming into the US around December, and two other strains, the Beta and Gamma strains, that are more able to evade vaccines. And so we have a strain that's very highly infectious and not quite as well protected against by the vaccines we've been using. Next slide. And some data from the CDC. You can see that if you look at how infectious a virus is, the further out on the x-axis you are, the more infectious a virus is. You can see measles is the most infectious virus we know about, compared to the common cold, which isn't very infectious compared to measles. Up on the y-axis is how severe a disease is. So Ebola, bird flu, MERS are diseases that are highly, cause high mortality rates. And you can see that the original SARS that we were dealing with a year ago was much less infectious than the SARS-2 Delta variant that we're dealing with now, and slightly less serious in terms of the amount of morbidity and mortality. But this moving out on the x-axis is striking. It makes SARS about as infectious as chickenpox, so that any holes in the Swiss cheese that Chancellor Koestler was talking about will be exploited by this virus and will accelerate spread. Next slide. On this campus, this is some work done by Rob Knight and by Smruti Karthikeyan. As everyone knows, we've been monitoring wastewater to look for signals of coronavirus, to know where to alert people that that they should be tested. And in addition to looking at signals that coronavirus RNA is in the wastewater in a given building, there also has been work going on to see which types of virus. And you can see that going back as far as April, purple is the Delta variant. The Delta variant was here. And now virtually everything we're seeing on campus and in the hospital and in most of the US is this Delta variant, which is causing much more pressure in terms of transmission of the virus to more and more people in the population, particularly those who aren't vaccinated. Next. Now, what about the vaccines? There are 3 approved vaccines in the US currently. There are 2 messenger RNA vaccines and a viral vector vaccine made by Johnson & Johnson. Functionally speaking, most people are now getting the messenger RNA vaccines, so I will talk just for a second primarily about them. Next. How do they work? They work very simply. This hamburger-looking structure is a ribosome. Each of our cells has many of these ribosomes in them. They're basically protein manufacturing machinery. And the way they work is our DNA in the nucleus of our cell, this is out in the outside of our cell, in the cytoplasm, sends messages in the form of messenger RNA codes to the ribosomes. And the bases, the order of bases in these codes tells the ribosome which amino acid to assemble into the protein that is coded by this messenger RNA. So ribosomes don't have any ability to do anything but make what they're told to. And our cells are always telling them to make various proteins to help the cell maintain its integrity. What these messenger RNA vaccines do is to take a messenger RNA molecule that's made in a factory that looks to the cell like a regular messenger RNA it's getting from its own nucleus, except that it says make viral spike protein. This viral spike protein is the part of the virus that helps us, our immune system, ward the virus off. So what we're basically doing is giving our immune system an opportunity to see the virus, the key part of the virus before we get infected, and to develop a much more rapid immune response. What are the side effects of these mRNA vaccines? Next. The ones that we see are ones that are very common in any vaccine. These are sore arms at the site of infection, and also systemic symptoms, flu-like symptoms that may last a day or two that are reversible. Some people need to take Tylenol, but for the most part, they are really quite well tolerated. The thing that's gotten people's attention with the messenger RNA vaccines is there are occasional more severe side effects. Next. The one most recently talked about is myocarditis. Myocarditis is inflammation of the heart muscle. Itis means inflammation. Myocardium is the heart muscle. This occurs in about 1 in 100,000 people, mainly young men, 3 to 5 days after their second vaccination usually, and they've all recovered. We don't know the mechanism of this, but we also see this cardiac inflammation in natural COVID, so that people who get the real disease can also have the same kind of cardiac inflammation. It has been reversible, and people have who've had this have gone back to normal life. But it is something that has caused a lot of consternation because of the concern that it's more common than it is. And next, final slide. So the COVID vaccines in particular, they do what they're supposed to do. They prevent disease in those who are vaccinated. They reduce transmission of the virus in our community by reducing the level of the virus in our breath. They reduce the number of people who are infected over time, making it harder for the virus to find itself from one place to the next. And they limit the evolution of new variants. So the vaccines have a very important role in our being able to keep our campus safe and for all of us to be healthy. I'll turn this back over to Vice Chancellor Satterlund.
Thank you so much, Dr. Schooley. Next, we'll hear from Dr. Cynthia Jamfi Bannerman, Chair of the Department of Obstetrics, Gynecology, and Reproductive Sciences, about the vaccine and pregnancy.
Thank you so much for having me and inviting me to speak. I wanted to be able to address the group surrounding concerns or misinformation with vaccination during pregnancy, and for those considering pregnancy or reproductive age who may have questions. And so for this first slide, I just wanted to show that pregnant people are at higher risk than non-pregnant people when they get COVID. So it's not that you're more likely to get the virus when you're pregnant, but when you are pregnant, because of the physiology, you are more likely to get sick. And this is just data from the CDC that shows that in pregnant compared to non-pregnant people, the rate of ICU admission was 3-fold higher, ventilation was higher, the need for ECMO to support breathing was higher, and death was higher in pregnancy rather than outside of pregnancy. Next slide, please. So as Dr. Schooley so elegantly showed, I want to just review from a pregnancy perspective, how really are these mRNA vaccines working? Certainly in a broad audience of folks with various levels of expertise, it sounds ominous to think of an RNA vaccine as you are developing a fetus. And so what he showed you, and I'm not sure if you can see my pointer here, but the virus is here on the bottom left corner, and you can see the spikes that are classic of the coronavirus. The mRNA only carries information to make those spikes, and it's the spike protein that's recognized by your immune system. The mRNA itself is rapidly degraded. So within a couple of days, it is gone from your system and the vaccine is no longer in your system. It doesn't enter the nucleus. It's not integrated into the DNA at all. And so it acts very locally and is very unlikely to cross the placenta. And now we have information showing that it really does not do that. Importantly, the vaccines are not live viruses, so you can receive them in pregnancy. They don't enter the nucleus, they don't alter human DNA in any way, and they do not cause any genetic changes to you or to your developing fetus. Next slide, please. One of the most important pieces of literature that has come out regarding pregnancy are the effects that was seen from a group of women that were vaccinated and had their pregnancy outcomes known. And so this is data that was published in the New England Journal of Medicine. The CDC has what's called a VAER system, which is vaccine adverse event reporting. And they looked in the first kind of 2 months after the vaccine was developed to see outcomes in pregnancy. So at that time, up until February 28 of earlier this year, there were about 36,000 or so participants that were identified as being pregnant. And of those, almost 4,000 entered their information into the VSafe system. And then of those, they had 827 that completed a pregnancy and had pregnancy outcomes. What these authors did was they compared the rates of pregnancy complications that are relatively common in vaccinated pregnant women to historical cohorts or the published incidence. Because those of us who practice obstetrics know that miscarriage rates and stillbirth rates are not zero. And so they compared those numbers. And with all of the pregnancy complications, there were really no signals or any concerns. The rates were similar in the vaccinated and unvaccinated group. If anything, slightly better in the vaccinated group. Next slide, please. And so what I really wanted to enforce were that recommendations changed actually just last week and most recently today by the CDC. So last week, the American College of Obstetricians and Gynecologists recommended that pregnant individuals are vaccinated against COVID-19. The Society for Maternal Fetal Medicine additionally recommended that vaccination is the best method to reduce maternal and fetal complications of SARS-CoV-2 infection, which is the virus that makes COVID disease. And then ASRM, which is the society that oversees fertility and conception questions, also recommended that vaccination either preconception or early during pregnancy is the best way to reduce maternal and fetal complications. And COVID-19 vaccination, importantly, does not impact male or female fertility or fertility treatment outcomes. And again, like I said, just today, which didn't make my slide, because today, the CDC also strongly recommended vaccination in pregnancy. I think it's important because pregnant people are kind of the lowest in terms of the groups of proportion that are vaccinated. It's about 23%. We see them get sick all the time, and the numbers are increasing around the country. Vaccination during pregnancy very efficiently gives antibodies to the developing baby, and so your baby is protected. It's less efficient while breastfeeding, but if you get vaccinated postpartum as well, you can give antibodies to the baby. So these are important updates, and I'm happy to answer any questions you have later on if there's time, and certainly in the chat we'll try. And thank you again, VC Satterlund. Back to you.
Thank you so much, Dr. Jamphy. Now we'll hear about the operational details related to the vaccine mandate from Dr. Angela Sosha, our Interim Executive Director of Student Health and Wellbeing and Chair of the Vaccine Mandate Working Group.
Hi, good afternoon, everyone. So there's been a team across campus and health system, multiple individuals working to build the infrastructure to allow us to comply with the mandate. The mandate does go into effect September the 6th, 2 weeks before the start of the fall quarter. You need to demonstrate full vaccination, and I'll explain how to do that, or you need to have an approved exception or deferral. Please submit these requests as soon as possible because, as I will go through, we need some time to evaluate them carefully and give you an answer. So at the very latest, it would be September 2nd, so you at least are time-stamped with a request, but please do it as soon as possible. Next slide. So individuals who are not fully vaccinated, in addition to having an approved exception or deferral, will need to follow non-pharmaceutical interventions, which are defined by each of the UC campuses, and they may change as the year evolves. We know this will involve masking requirements as well as surveillance or asymptomatic COVID testing. For the fall quarter, unvaccinated individuals will need to test twice a week. That will be no sooner than 3 days apart and no more than 5 days apart. That will be required of all of those that are partially vaccinated as well as those that are unvaccinated. Okay, next slide. So how do you demonstrate your vaccine status? We worked hard to create a system that is easy for our employees, that captures the information in the employee health record, which is your My Chart. And the reason for this is that builds us the compliance tools which will need to demonstrate your compliance with the mandate and throughout the course of this year. If you've been vaccinated at UC San Diego Health, which includes all the health clinics at UC San Diego, as well as Petco, REMAC, or the Price Center, respond to your My Chart message. It'll ask you to consent to share with campus. What you'll be sharing is your vaccination status, that you're fully vaccinated, not the details clinically of what medication or vaccine you got or the dates. It'll just be that you're fully vaccinated and you meet the compliance requirement for the mandate. If you received only one of your 2-dose series at UC San Diego Health, or all of your vaccination was outside of UC San Diego Health, please add your vaccination information into My Chart. That available details how to do this is on RTL's site. Please know that some providers have shared information with the California or San Diego immunization registries, so your information may be there. Check that. If it's there, you're great. Otherwise, you can upload your information documentation. It's very easy, and you can consent to share. Once you've done that, you're done. There's nothing more that you need to do. We are accepting international WHO approved vaccines. This is really important for our international student community, and some of our employees also will be part of this community. Please know that all the details about how to comply with the vaccine documentation are on the RTL site. Next slide. So there are medical and disability exemptions. Please know these require certification by a healthcare provider, so more than just the employee's statement. The religious exemption and the deferral for pregnancy are only require the employee to fill out the form. I hope people will really hear the importance of vaccination during pregnancy. As a perinatologist myself, it is really important that we get our pregnant women vaccinated. Your medical and disability exemptions may be temporary or permanent. Permanent medical will be a contraindication to being vaccinated, and there are a few medical contraindications to vaccine that the CDC and vaccine manufacturers have recognized. There also are indications for temporary, which is provided in the mandate. Although clinically we may not encourage you to do this, you have the option to do this, that if you've had a recent COVID-19 infection or a positive antibody test, you can defer for up to 90 days. Next slide. Now, the process for employees is you need to complete, this is if you're asking for an exception or a deferral, you need to complete a request in Qualtrics. This then goes to a third-party administrator that has been contracted with on the part of multiple UCs at a UCOP level. They're a very experienced team. They will be working and you will be providing the information directly to the third-party administrator. You don't need to bring it to your manager, send it to HR, send it anywhere else. The third-party administrator will work with you. They have the ability to approve your request. If they approve it, you'll be notified, and then you just need to follow those non-pharmaceutical interventions, masking and the testing requirements. They will not issue a denial, but they will issue non-approvals. The non-approvals then will be dealt by various sectors on the campus, including employee health, disability through HR, as we will have a religious exemption group that will be looking at religious requests and consistently applying some principles and standards for decisions of approval or denial. Next slide. Terry, your turn.
Thank you, Angela.
Go for it, Terry. I know that Cynthia Palmer, Assistant Vice Chancellor for Academic Personnel, is going to join you as well.
That's right. So As Angela stated, we have the exception and deferral process that we've been really working hard to try and make it as simple as possible for everyone involved. As we've noted, compliance is required by Monday, September 6th. Yes, we do know that's Labor Day, and no, we do not expect you to work on that day if you're not otherwise scheduled to work. What we're hoping is that instead you will do everything you need to do between now and then, so that you're not waiting for that last day to engage with the process. Submit your requests ASAP, but certainly no later than Thursday, September 2nd. For the types of exceptions that are available to folks, as Angela noted, there's the medical exemption, the disability exception. Both of those could either be permanent or temporary, depending on the underlying circumstance that the doctor has determined. And the doctor can complete that information on the form that would go to the third-party administrator. For the religious exception process, you would complete that form and submit that to the third-party administrator. And then for the deferral for pregnancy, I'm hoping after listening to the earlier presentation that no one will now need to complete the deferral for pregnancy form, because it is so critical to get vaccinated if you are otherwise able to do so. So I'll go back a little bit to that compliance timeline because there's a lot of Q&A questions, and I know we've received a lot of questions on our various support desks about, what does that Monday, September 6th date really mean? Does that mean that if if I do not have an approval, or if I've not already updated my vaccine information in my chart, does that mean that I can't show up to work on Tuesday, September 7th? No, that's not what that means. You would not be prevented from showing up to work without being specifically told that you cannot show up to work. So as many of you who have read through the policy know, there is a process for folks who either don't engage with the policy at all. So that's the notice of non-compliance process. And so as we walk through that process and just really work really hard to get everybody engaged with the process, that would really dictate what's going on. So everyone still show up to work as regularly scheduled until you are told that you shouldn't. As it relates to those non-pharmaceutical interventions, I know there's a lot of questions about that as well. So right now, everyone is required to mask indoors. That is not a separate and apart non-pharmaceutical intervention at this time. That is simply a requirement for everybody at UC San Diego. You have to mask indoors. And so then as it relates to specific NPIs that may apply to personnel once they have an approved exception or deferral, those folks will then have to engage in testing twice weekly. So minimum 3 days, max 5 days. The easiest way to remember it is just test every 4 days and you're good to go. And as Angela noted, this may evolve as the year progresses. And I know there are a lot of questions. Well, what if I have a hybrid work arrangement? What if I work remotely? What does that mean for me in this testing process? Stay tuned. More details are to come because we haven't forgotten you. We do know that we are in the middle of our return to campus efforts, and we need to make sure that people know exactly what to do. Cindy, anything you want to add there?
No, perfect, Terry. You got it all.
Thanks. Next slide. So the number one question that we have received is, what is my role as a supervisor in ensuring compliance? Well, the first thing that you should do as a supervisor is to ensure your employees know that they can engage with this process, how to engage with the process, how to read the policy, how to see everything that's in the policy, where to go for questions on the RTL site, on the Blink page, whatever applies to them, how do they engage? You help them get there. The other thing that you'll do is you'll be monitoring a supervisor dashboard coming soon, and be aware of any non-pharmaceutical interventions that your employees need to be engaging in. So to the extent that your employees are required to engage in supplemental testing, we will assist you in the types of communication that you need to engage in with your employees on that subject. So don't go out on a limb. Don't try and figure it out yourself. We will be there for you. We will have templates. We will give you language that everybody's working from before you engage in any of those discussions. But as it relates to right now, as I stated before, everyone has a requirement to mask indoors. So if you are a supervisor and you see one of your employees not wearing their mask indoors, you need to have them wear their mask indoors. So that's something you need to be doing right now, regardless of this policy. The other thing is to communicate any requirements and expectations for your employees. Like I said, there will be template language provided. You do not have to make this up on your own or reinvent any wheels. Additionally, don't ask your employees, your student employees, or anyone their vaccine status. People may share their status. Some folks are really proud of their vaccine status, whether that's vaccinated or not. And that is for them to share, not for you to share. So if they share it with you, now you know it. Does that mean you should share it any further? No, you should not. It is for them to share their own status. I'll say it again for those who need to hear it one more time. Don't ask someone their vaccine status, and don't share anyone else's vaccine status. So the supervisor dashboard. I know it's hard because I know everyone loves a visual. And once we have a visual ready, we will present it. But what we're working on behind the scenes, and I really just want to give a shout out to our ITS partners who have been really supportive through this process. But what we've done is created what they've done is created a color-coded dashboard for supervisors to log in with their AD login. So it's under the two-step authentication. So they can see who is in compliance, who's not in compliance, and if there are any further steps to be taken. So a supervisor won't know specifically whether an employee is vaccinated or not vaccinated. What they will know is whether the employee is compliant, whether they're compliant and need to take any additional steps, and then whether they're not compliant. And if they are not compliant, what they need to do next, which is often going to be consulting with their departmental HR or AP contact on what the next steps are, and not to initially go and engage with the employee or to remove anyone from the premises or anything of that nature until they've consulted with their HR contact or AP. For questions and support, this is all on the RTL site, but people should know that they can engage with the sdvaxro@ucsd.edu mailbox on how to engage with the vaccine mandate. And then you can also bring your questions to your departmental HR contact and AP representative for additional questions. Cindy?
Yeah, one of the biggest questions we get from our academic appointees is, who is my supervisor? Or am I a supervisor? If you have any of those questions, contact your AP or HR rep in your department. They know who your designated supervisor is. And again, I reiterate what Terry already said, we will provide training. All of your supervisors out there who are academics, department chairs, PIs, directors of centers, you will be considered supervisors and you will be provided the training.
Next slide. So some of our most often presented questions in our various meetings as we've been leading up to this vaccine mandate town hall. A number of folks need to understand the distinction between, I have a flexible work arrangement, how does that mean I should engage with the policy, versus I have an opinion about the policy and how I should engage with it. Can that dictate my flexible work arrangement? So the answer to that second question, no. Your flexible work arrangement is based on operational needs. So to the extent that your supervisor has looked at what the operational needs are for your job and determined what the appropriate flexible work arrangement is for that, and made you an offer about what makes sense for that work, and then you've determined that together, at that point, then you figure out, okay, based on that information, how do I engage with this policy? The short answer is, if you are fully vaccinated, document it in my chart. If you are seeking an exception or a deferral, go through the process. That's really for everybody. The only distinction there will be is how those MPIs will be handled as it relates to the type of work arrangement a person has. And if there is going to be a differentiation, we will let you know. But you should engage with this policy regardless of your work arrangement. And that includes those who have fully remote work arrangements. I get that question all the time. But Terry, I'm going to be 100% remote. I shouldn't have to engage with this policy. Well, I guess that assumes you will never set foot on any UC property during the entirety of your career. the likelihood of that is probably very small, because you may fly here from someplace out of state to engage in an all hands meeting or work on a special project. You may be down the street, but working remotely and have to come in and have your laptop serviced at the hub. You may have a number of reasons you want to come on campus to engage with an event or some other thing. Don't just assume you will never come here ever again, if that is a possibility related to your work arrangement. So you don't have to have any anxiety, just engage in the process right now, get it done, mark it off your list. There are enough things you have going on in the world to be worried about than this. Get it done, and you don't have to worry about it. As it relates to what COVID-19 leave options are currently available. We haven't talked about leave options in a while, and so I know that's why this question comes up pretty often. But what people have to remember is there's still the 2021 emergency paid sick leave that is available to employees. That was something that you see system-wide authorized for employees, and that's through September 30th of this year at this point. If there will be further extensions, we'll let you know and we'll communicate it out. But there's also Cal-OSHA leave that is available, and that's the circumstances where an employee has had an exposure as determined by our COEM, and they're required to be at home, but they're otherwise able-bodied and able to work, but we aren't letting them come on site to work, and there's not remote work available for them, but it's to ensure safety in an exposure circumstance. In that case, then we wouldn't have the employee use their own personal leaves. They would have access to Cal-OSHA leave. And information about our leaves is on our Blink page for the paid leave options, if you have questions about that. And then the last question, what options do employees have for not getting vaccinated if they don't otherwise qualify for an exemption or deferral? The short answer is they have to engage with the policy. So they either need to get vaccinated and fully vaccinated, or and get that documented in their MyChart, or they have to get an exemption or a deferral. And if they don't qualify, then the answer is to go and get vaccinated. Because otherwise we're gonna just be pestering you about getting engaged with the process, so that we don't have to go down the road that all the folks are asking about. What disciplinary actions are there? And we don't want to get into those specifics, because we don't want anybody to have to fall into that process. Instead, what we do is like to get everyone to be compliant and not have to have those discussions, because we know everyone cares about the safety for themselves and their colleagues as we continue to do the work that we do together. Cindy?
Yeah, just reiterating again that all of the answers Terry provided to each of those 4 bullets is equally applicable to our academic appointees, including the sick and leave options for COVID-19, EPSL, the employer paid sick leave, and the Cal-OSHA leaves are equally applicable to our academics. If any folks are in titles that don't accrue sick leave, I know that those are really worrisome considerations, but please contact your departmental AP and they will contact us if anybody has need of COVID-related sick leave. And again, I encourage everyone to get vaccinated. That's the safest for all of us involved, and then you don't have to worry about being out of compliance.
Thanks. And I'll turn it back over to you, Alysson.
Thank you both so much, Senior Director Winbush and ABC Palmer. Now we'll go back to Dr. Sosha to talk about our campus policy in relation to safety guidelines and updates regarding masking, symptom screening, and testing.
Great. I want to mention something I didn't earlier, and that students are not going through the third-party administrator. We've developed parallel processes that are being managed here on campus using the Vice Chancellor for Student Affairs Office, Student Health, and the Office for Student Disability. So they have a parallel process, but it's on site. Student employees, we have many of those individuals on our campus, should follow the student pathway. They should not submit duplicate requests, a single request, and it should be through the student pathway. Now, I think it's important to remember that all along through this pandemic, we have had an approach with 3 core elements of viral detection, intervention, and risk mitigation. It has been science-driven. We have adapted. We have changed our recommendation throughout the pandemic, and we'll continue to do that. We'll be science-driven and we will adapt. What's really different than the past last year is this vaccination on the risk mitigation. It is critically important to controlling this virus in our community, both San Diego at large and our campus community. Next slide. Our core viral detection methods stay in place, which is the PCR testing. This is at no cost to you. You can do provider administered testing at the Price Center, or you can get a self-administered test and the multiple different vending machines distributed throughout campus, including the 2 drive-up sites. Please take advantage of this testing. You do need your campus ID to swipe to get the kit. It is $1 on, but the dollar comes right off. So there is no cost to you. Make sure you have your ID. If not, get it updated and get a new one. The wastewater will continue. We have multiple wastewater samplers covering an enormous number of our campus buildings, not every single one, but the vast majority. If you go to the dashboard, you every day could see which building has a signal. It has been highly effective in picking up individuals who are shedding virus in their stool. So we want individuals who are residing in a building where there's a signal to get tested, regardless if you're vaccinated or not. We also, if you've been in one of the other campus buildings and there's a signal and you use the restroom facilities, please get tested. Next slide. This is a summary of where we are now. So as we think through the mandate, we also need to pay attention to what we're doing on the core of keeping everyone safe. For the residential students who live in congregate living, it's a little bit different. Some of the things are exactly the same. You'll see indoor masking is responsible for everyone. Everyone is doing indoor masking. For the students, they do not have to do this in their personal bedroom or the shower. What is a little different is our residential students go through a different testing process when they first arrive on campus. This is for both the vaccinated and the unvaccinated community. They are going to be tested on arrival. That's the first step before they get the key to their apartment. They will also test day 5 and day 10. And then those that are unvaccinated and have exemptions and deferrals will be doing the twice weekly surveillance testing. Everybody should test for symptoms. We're all going to keep doing the daily symptom screener. Everybody should test if they're a wastewater signal. The difference is the surveillance asymptomatic testing is different in the unvaccinated community. This process is what we've used every quarter this year. It has worked extremely well for us to be able to keep a safe campus environment. In fact, safer in campus than outside in the community. For non-residential students and employees, indoor masking again. The testing if you have symptoms or wastewater signals. We're asking the unvaccinated community to also get a test within 48 hours of arrival for any on-campus activity, and then to begin the twice weekly testing. So just want to reassure everyone, our processes are intact. We will continue to evaluate. One of the questions I saw in the chat is, will the vaccinated community need to test every week? We are looking very carefully to see if the science supports this, and we'll have an update on that question. So be prepared for updates throughout the fall quarter. That is how we stay ahead of this virus. Next slide. I think we may be moving to Q&A.
Yes, Dr. Socia, you're absolutely right. So we're going to move on to the next segment of our town hall today. So I'd invite all of our panelists to turn on their videos, please. During registration, attendees had the opportunity to submit questions for panelists to answer, which we've tried to do during the course of today's presentation. We've selected some of the most popular questions to address in our panel today. We are running a few minutes behind, so please know that if we weren't able to get to all of your questions today, we will do our best to post them in the FAQ at Return to Learn. So first, a question for Senior Director Winbush. What rules apply to vendors, affiliates, and visitors to campus? And will proof of vaccination be required for these populations? If so, how? I guess that was 3 questions, Terry.
It is, but it's a really simple answer. So as many of you know, and Dr. Sosha mentioned, we have a vaccine policy work group that meets several times a week and over email as we're working through all of these various processes. And so we are discussing what will happen as it relates to our vendors and our contractors and visitors for that matter. And we'll update the RTL website as decisions are being made in that process. You should all know we are engaging with our campus colleagues who manage these things like procurement. And what we've been doing for the most part is limiting the number of vendors that have been coming on site, because that is the simplest way to engage. But as we put forth processes, we will post those on the websites for people to know.
Thank you, Terry. Now a question for Dr. Schooley. When do you expect that booster shots will be needed and available? And do you anticipate that they will also be mandated?
I think booster shots are going to be necessary. I think people have been a bit slow to acknowledge that. We're seeing breakthrough infections in people who are vaccinated since last spring, as I mentioned. Some of them are more severe in people who are at greater risk for getting sick, and we would expect that because they were vaccinated first. When they were vaccinated, their immune systems may not have been quite as robust, which is why they were at greater risk. So we're beginning to see these breakthroughs. We see people who had renal transplants and people who are on certain immunosuppressive drugs are not as well protected by vaccines. So they will probably be the ones offered vaccination boosters first. As the general population immunity wanes and as the virus continues to evolve, those boosters will be necessary as well. Some people have said, well, why should I get vaccinated now if I need to be vaccinated again anyway? Well, the reason for that is you're not protected now if you're not vaccinated now. And the booster shots may not be something that the general public will need until early 2022. My own feeling is that we need to be careful about not waiting too late and ending up seeing more breakthroughs and more people in the hospital because we're being too conservative about it. No decision has been made to my knowledge about how that will be factored into the vaccine mandate. But we do have the IT capacity to be able to include that in any of the apps that are available to verify vaccination.
Thank you so much, Chip. We have a question for Senior Director Winbush and ABC Palmer. What will be the disciplinary action taken if someone is not vaccinated prior to going back to campus? And I assume this means they have not requested an exemption or deferral.
Yeah, I mean, the first steps that people need to know that we're going to take is to try and get folks to engage with the process. That's where we will spend a lot of energy and time because it's so critically important that folks get vaccinated or get that exemption or deferral. And I'll say deferral really quick because I don't really want people getting deferrals. I want them to just get vaccinated if they're pregnant and able to otherwise medically get vaccinated. But they really need to just engage with the process. It's going to be on a case by case basis. There's not going to be a blanket, everyone will get this and everyone will get that, because it really will depend on the level of non-engagement or what exactly is going on in the circumstances for each employee. Cindy?
Yeah, it's also dependent on the type of employee. Everybody has a different disciplinary process that's applicable to them. So if you're an academic appointee, we have the APM, for example. Staff appointees have different staff policies, but we're a long way from talking about disciplinary process. We're really talking about getting people vaccinated.
This is a subset, really, Terry and Cindy, of this question. I think it's about the process. If the process is delayed, specifically if someone's not able to obtain their medical exemption prior to the specified return to work date, what guidance would you provide to them?
So I'll just say something about the terminology because I know folks are very sensitive. I know the folks have been working this whole time very hard. So their return to campus change in work modality, for example, is if that's what they're curious about, and their exemption hasn't been approved at that time. We will know if you're in the process because the wonderful thing about that Qualtrics survey and why we developed that is it's an easy way to check, like, has the person even engaged? And are we just waiting on an approval or are they in the review process, et cetera, right? So we'll know that they're trying, and that is really key. And then they'll engage in those MPIs while we wait on the finalization of that process. So don't fret. we will know that you're trying, and you should just make sure that you engage in the process as soon as possible, because that'll be the best way to not have any delays.
Thank you. And then one last question for the two of you. Who will our team members need to share vaccination cards with? And if they're vaccinated by UC San Diego, do they need to take any specific action?
Yes. So for who they provide their information to, that's the who is my chart. It's the system. That's who they need to provide their vaccination information to. And if they were vaccinated at UC San Diego Health, they do have to do something. They have to go into their my chart, check their messages, and then read the consent process that's there. It's very quick. It takes about 5 to 10 seconds, even if you read it twice. And then you check the box, and that consents to share the specific compliance with your employee information, so that we'll know that you're compliant with the process. But yes, you do have to take some action, and yes, engage with MyChart. That is the safest place to have your data. We don't want it in people's emails. We don't want it in a PDF file that can be, accessed by someone later. We want it in a nice, safe, protected, encrypted place in MyChart where it can be protected by the healthcare professionals.
Thank you both for that. Now a question for Dr. Sosha. Will routine testing be required for all employees regardless of vaccination status? And do you have a sense yet of the frequency? Has that been decided?
Yes, so I think right now it is only going to be for sure required of the residential students regardless of vaccination status when they come onto campus. As I mentioned, the unvaccinated community will need to begin their twice weekly surveillance and test within 48 hours of coming onto campus with the mandate. And we encourage you to do that right now, in fact. We are assessing whether there is a benefit to everyone testing asymptomatically in the fall. And that could be once a week, or we may say there's not enough benefit to do that. Or we may do it if, let's say, we faced an outbreak or an uptick, and so it could change this fall. Right now, not absolutely required. The part that is required, though, is the daily symptom screener. Please test for symptoms, and please test for wastewater signals. If you're working in a building using that restroom facility and there's a signal there, you might be vaccinated, but you might be shedding the virus. Let's find out so you can take care of yourself and those you care about.
Thank you, Angela. A question for EVC Simmons. What considerations have been made for Delta variant spiking, and are there considerations for remote work or a potential shutdown again?
Thanks very much. So I think that you've been hearing about general precautions that are being taken because of the Delta variant, including the continued and ramped up testing, the continuing requirements for indoor masking. If there, we've already established processes for individual employees to work with their supervisors to determine modality of work, whether that should be hybrid, remote, in person, depending on the business needs of the unit and all the detailed circumstances. And that continues. For teaching, we have a process in place which we've had in place for so many weeks now, whereby an instructor, whether they're faculty, lecturer, TA, who wishes to request to teach remotely would approach their department chair and make the request, and the department chair will look at the academic needs of the unit to figure out what can be taught remotely, what needs to be taught in person, and try to adapt to the personal circumstance of the person making the request. As for a large-scale situation like taking the entire campus remote again, we have in place the same safeguards that we've had since the beginning of having the COVID monitoring team watch all of the public health data every single day, both on campus and in the community, and make daily reports. And as necessary, a COVID response team is convened to determine whether there's a need for an urgent change, like having extra testing or changing the modality of instruction. So we're looking at that every single day as a campus to see whether any changes are needed. We've been doing that all along. We will continue to do that. And that's how we'll make the decisions. COVID response team then brings questions up to the cabinet for discussion and the chancellor for ultimate decision. And so we have a systematic process that's going on every day.
Thank you, EVC Simmons. I think that's an excellent way to end our time together today, and just reiterate that the Return to Learn website is the primary, most consistent location to stay informed of our Return to Learn plans. And we want to thank all of our partners today who brought this effort together, and continue to thank our team members and the more than 1,500 attendees who joined us today. We ask that you stay well and continue to take care of one another. Thank you so much, everybody.